Welcome to the 9th annual UNC Health and Human Rights Lecture. It's so great to see so many of you in the room. This lecture series was established in 2011 to promote human rights as a basis for public health, with our speakers elevating human rights from principle to practice and transforming human rights into health policy. My name is Suzanne Maman. I'm the Associate Dean for Global Health here at the UNC Gilling School of Global Public Health. After 2 years online through the COVID pandemic, I'm delighted to welcome everyone back to this in-person lecture with a hybrid option for those of you joining us from around the world. Over the years, this interdisciplinary lecture series on health and human rights has brought to Chapel Hill global leaders in the application of human rights to public health to speak with our faculty and students here at UNC. With sponsorship from the UNC Department of Public Policy, the Center for Bioethics, and Gilling School of Global Public Health, I'm grateful to the UNC Health and Human Rights Lecture Committee for their tireless work across the departments to make this extraordinary event happen every year. In these times, this lecture series is an expression of UNC's continuing commitment to human rights advancement for public health promotion. Thank you all for your inspiring engagement in discussing realizing the right to health through healthcare technologies. Considering whether new health technologies will support efforts to realize the right to health, or whether these technologies will violate human rights. To introduce you to our groundbreaking speaker and her exciting new book, please let me now welcome Dr. Anjali Palmquist. Dr. Palmquist is a professor in the Department of Maternal and Child Health, bridging medical anthropology and global public health. She's also a thought leader in the Carolina Global Breastfeeding Institute, and she's newly in the role of co-leading the Gillings Humanitarian Health Initiative. So welcome.
Thank you, Dean Maman. I wanted to make sure that attendees know that this event counts as a campus life experience for those of you who that matters. I'm very excited for this year's lecture on the right to health through healthcare technologies. And it is an honor to introduce you to Katharina Ó Cathaoir, an associate professor of law at the Faculty of Law, University of Copenhagen, and a pro Futura Scientia fellow at the Swedish Collegium for Advanced Study in Uppsala. As a human rights scholar and global health advocate, Katharina researches and teaches in the field of health and human rights law. Her research focuses on the rights of those at the margins of health law, including older people, children, and migrants. Katharina's research spans classic topics like access to abortion and healthcare, and newer themes like regulation of big data and algorithmic decision-making. Dr. Ó Cathaoir has conducted ethnographic and legal research on precision medicine in connection with a 5-year interdisciplinary project entitled MindWe, and contributed to drawing up EU standards for data sharing. Katharina is currently engaged in research that explores the legal regulation of the data gap and gender bias in the context of Nordic and EU health law, with reference to the right to health and the right to enjoy the benefits of scientific progress. Katharina is co-author of the 2nd edition of the Health and Human Rights European and Global Perspectives, which informs the basis of her talk. Dr. Ó Cathaoir will speak briefly about the topic of today's discussion in her new book, after which she will be joined in conversation with Professor Benjamin Meyer, a professor of global health policy, I'm sorry, I almost said Ben, at the University of North Carolina at Chapel Hill, and the chair of the selection committee for this UNC lecture series. Thank you to all who are joining us at UNC and around the world. We hope to have time for questions at the end of discussion. If you are online and have a question for Katharina, you can submit it through the Q&A box at the bottom of your screen, and we will draw from those questions in this crucial conversation for the future of health and human rights. And thank you, Katharina, for joining our Health and Human Rights lecture series. I will turn the conversation over to you and your opening remarks.
So thank you so much. Thank you for being here, and thank you to Benjamin so much for the invitation. So just to start out, I live in a very digitized welfare state, Denmark. And if I go to the doctor and I have a scan, basically a few hours later, and you might have the same experience, I'll get an email with the results of the scan. So the smart person would probably wait till the doctor calls because I'm not a physician. But of course, I go to Dr. Google and I try to diagnose whatever I suspect I probably have. So this anecdote is just to sort of set the framework for what I want to talk about. And that is different themes such as informed consent, autonomy, and access to healthcare. So what is the answer here? Should I have access to this information? Is it benefiting my health? Or am I simply confusing myself with something I don't understand? So the aim of my lecture for today is to talk about prospects and perils of new and emerging healthcare technologies from a human rights standpoint, and to make suggestions for what elements should be central to realizing the right to health through healthcare technologies. So just to start out, what do I mean by healthcare technologies? So there's different features, and this isn't to say, a definition, but just to say that there are different features when we talk about healthcare technologies. So some of these are that healthcare may be digitized. So we move to a digital monitoring system instead of a more analog system. Furthermore, certain aspects of the system may be automated, such as the processing of data used to create a reading, or in some cases, a prediction. In some cases, procedures are being replaced by robots. So you may have heard of robot surgery, but also in older people care, sometimes you have a robot pet instead of a physical pet. Another facet can be real-time monitoring. So the patient's vitals are monitored remotely. For example, ingestible sensors allow body functions to be monitored in real time, heart rate and blood pressure. And this can give patients information before they have to wait to be told by their doctor. Another facet that's predicted to be increasingly interesting in this field is predictive healthcare technologies. So for example, the use of algorithms to make predictions based on data sets. In terms of, for example, what medicines are likely to be effective for a particular cancer tumor. And key to this is artificial intelligence systems. So software based on inputs that delivers predictions, recommendations, or decisions with varying degrees of autonomy. Through machine learning, algorithms are trained on data and may continue to learn during the lifetime of a system. And finally, all these technologies are enabled by big data. And this is the gathering of massive amounts of data from patients, but also consumers or research subjects. So from the perspective of the right to health, new healthcare technologies are potentially a cause for optimism. So by digitizing and automating processes, technologies might become cheaper and more available. The digital nature could enable patients in remote areas to access healthcare without long and expensive travel. And this is certainly echoed in WHO recommendations that lauds technology as a new frontier for access to healthcare, which is a key feature of the right to health. An important question is furthermore whether and when states are under obligations following the right to health to provide new technologies. And this raises interesting questions about resources and equality. So in existing doctrine on the right to health, such as general comments, recommendations, academic scholarship, the focus is generally on states' core obligations to provide access to essential healthcare, such as essential medicines. And it seems when we talk about minimum entitlements, the right to health cannot mandate a specific advanced healthcare technology. Instead, access to healthcare technologies may fall under states' obligations to progressively realize the right to health. But furthermore, according to the Committee on Economic, Social and Cultural Rights, the right to benefit from scientific progress under Article 15 imposes duties on states to make available the best applications of scientific progress necessary to guarantee different rights, such as the right to health. Also, freedom from discrimination is important in this field because it implies that states should not invest in treatments that discriminate against a particular group or systematically neglect a protected group. So there's various examples of positive impacts that new healthcare technologies can have on access to the right to health. So, for example, through relatively inexpensive wearable devices, individuals can track their vitals and be prompted to, for example, exercise. Furthermore, online databases or fora can enable patients with rare diseases to connect with patients like them in different parts of the world. The World Health Organization is embracing this to a certain extent through Florence 2.0, who is an AI that gives advice on healthier lifestyles and mental health and is freely available on their website. A further point is that research has shown that medicine already exhibits bias towards, for example, people of color and women, where their pain is underestimated or minimized. And it can thereby be asked whether data-driven healthcare can be more objective, more scientific, and thereby less biased when examining patients. So there are clearly prospects for improving access and accessibility of healthcare for people with limited resources, rare conditions, or who live far away from care. But of course, there are risks. And I certainly fear that states or companies will invest in unsustainable technologies due to perverse incentives where basic public health measures may be more effective instead. And healthcare technologies pose particular privacy and autonomy risks. Generally, we look to consent as the central legal protection in this case. By consenting to data storage or reuse, individuals, in theory, can make autonomous decisions about how and when their data is being used. But this paradigm is increasingly questioned due to growing digitization and complexity. Shoshana Zuboff writes in her book, The Age of Surveillance Capitalism, of the oppressive privacy policies of many devices, like Fitbits. She describes how the devices are intentionally priced low to enable ubiquity, with policies, what she calls uncontracts, that mean a consumer will never really understand what they're signing up to. And even if they do, the policies change so often that they won't know what they signed up to in a few weeks. Another example is whole genome sequencing. There are many unknowns about the human genome. Can a patient truly give informed consent when there is so much knowledge yet to be revealed? And genetic information may also be familial information. So by sharing information about yourself, you could actually be exposing your family. Many of you will have heard of the Golden State Killer, and this person was caught when police uploaded a sample to an open access genealogy website where a relative of the killer had actually already uploaded his data. Or take the reuse of medical data. Most of us would like to be asked prior to our health data being reused for research purposes. But can consent be sufficiently precise where the research study has not yet been designed? A further risk relates to existing global inequalities. Will advanced technologies lessen or contribute? Will only those with resources, be they financial or social, benefit from the promises I have described? I'm not really a tech optimist, but I'm also not a tech pessimist. But I do fear that inequality will undermine some of the progress. Within states and cities, there are dramatic inequalities in terms of health outcomes, also in welfare states. So for example, the map on the slide shows the different life expectancy just based on what tube stop in London you live on. Will resources be funneled into high risk, high gain tech that benefits a select group of the population? Will companies invest in sustainable, necessary technologies? And what if investing comes in technology comes at the risk at the cost of more fundamental public health? Giant companies like Google, Amazon, Facebook, Zuboff argues, are motivated by profit, not human well-being. So how do we ensure innovation in healthcare, which is necessary, but that is also sustainable and doesn't injure other human rights like privacy, non-discrimination, equality? So one aspect that I think is fundamental is an adequate legal infrastructure that protects privacy and actually provides for genuine sanctions for corporate abuses. In the EU, as you can see on the slide, we have numerous new regulations that have been adopted or proposed that seek to impose higher standards on providers and manufacturers. The General Data Protection Regulation, GDPR, for example, provides for important rights for individuals, such as access to data and the right to correct data about oneself. But there's also a risk that these regulations are not well adhered to. And as we've already seen in other areas, like the regulation of unhealthy products, that companies will move their criticizable practices to countries with more relaxed standards. So more than ever, what we need is global standards. And as a human rights scholar, I believe that human rights standards should be fundamental to such a project. And these include standards like non-discrimination, equality, and privacy. So in this regard, I'm somewhat skeptical, but also concerned about what can be described as the ethicization of human rights. So for example, the European Commission speaks of ethics of artificial intelligence, claiming law is too slow to govern rapidly changing technology. And technology companies are also very enthusiastic about relying on ethics, because then they can always argue that their conduct is ethical. Whereas when we talk about human rights, we're talking about rights that are owed to all individuals on account of their humanity. So therefore, the message of my talk is that human rights should be central to the future of healthcare technology, such as conducting human rights assessments prior to developing and entering new products on the market, and continuously monitoring products that are being released. Systems should be designed as long-term solutions, not mere fads, to ensure sustainable technologies that stand the test of time. Communities should also be heard and taken seriously, not just the wants of technology companies. At the start of the talk, I questioned the approach of throwing information at patients, but I am actually passionate about transparency in healthcare. But I think we also need common sense to providing patients with information that they can actually actively act upon. So thank you very much for your attention.
Thank you so much for being a part of this exciting conversation. I'm Benjamin Meyer. I'm a professor of global health policy here at the University of North Carolina at Chapel Hill, and I'm the chair of the Health and Human Rights Lecture Series. Delighted to welcome Katharina Ó Cathaoir here. I'm going to be sitting with her and asking a few questions to kick us off, followed by a few of your questions as we move forward. So really excited about hearing how the right to health can be used in this context and thinking about what it means to talk about new technologies. But so much focus at the intersection of health and human rights recently has been to shift away from health technologies and to focus on public health and underlying determinants of health. As we begin to focus on these new technologies under the right to health, as you said, lauding these new technologies as the new frontier, how do we avoid biomedical determinism? How do we make sure that this focus on expanding the promise of new technologies doesn't cut against our efforts to improve public health?
I think it's an important point, and I think it's difficult. I mean, what I really fear is that, in particular, private companies really will sort of dictate the nature of the conversation. And I think that is definitely a risk, that we focus too much on particular really expensive technologies that are only going to benefit certain people. So why am I talking about healthcare technologies then? Well, because I think that there hasn't been, from a right to health standpoint, enough focus on actually sort of going through and examining what are we talking about. I think we always talk about from a privacy standpoint, but there is also these prospects of using healthcare technologies to contribute to bigger aims and agendas.
And so this focus on how human rights are impacted by technologies is really a central focus of this amazing new book, Health and Human Rights. Just delighted to see it adding to the discipline over the course of the past year. Ryan, if you can grab, there's some flyers right there that you can pass around with some more information about this exciting new book. It's the second edition of a book that's really helped to shape the field. And as we think about the field more broadly, one of the questions that you raise is around discrimination. The idea that right now we're very concerned, rightly so, about biases in medicine. How do we ensure that these new technologies don't merely reproduce our biases without even a person behind them?
Yeah, it's a really big risk. And I mean, in the EU right now, there's been a new regulation, an AI regulation that's being proposed. And one of the aspects of that is to actually, and it hasn't been adopted, so that the text isn't agreed, but to actually start discussing the quality of the data that's being used to develop these systems. Because there's been so many examples of using, for example, in developing new medicines, just using data of, middle-aged white men. And then they found that, well, actually not a drug doesn't always perform the same way for a woman, for example, due to different hormones. And the same with children. So often children have just been given drugs off-label that actually haven't been tested on them. So I think looking at data quality is a really important, but it's not an easy answer either, because then the pushback a lot from scientists has been, well, what does this really mean? And is this always feasible? So, I mean, one aspect that I think is important and that I've done in my work, and I would sort of encourage other scholars in the field, is to try to get into projects with people who are making these technologies. So be you a lawyer or a human rights scholar, and actually try to do these assessments and be involved in assessments and start speaking up and thinking of, okay, well, what groups is this benefiting? What groups is this affecting? I think there is an important role for us in these discussions.
And so this implies that there'll be a tremendous amount of data.
Yeah.
And I think that raises some of the risks that you bring up in this context, that there's going to be a balance here, that in order to improve public health, we need a tremendous amount of data that will limit individual privacy. Mm. How do we balance this need for data to protect the public against this risk that doing so for the population will undermine or limit the privacy of the individual?
I mean, we talk a lot about in this field about something that's called the privacy paradox. So there's definitely someone sitting here on Facebook right now, right, sharing your personal data. And I think many of us, when we get the bar about do we consent to cookies, people just scroll through. So, and this paradox is about how basically we're sort of wantonly giving away so much data, and that's a bigger discussion about, is it possible to avoid giving away so much data? But at the same time, if somebody wants our health data, if we're being informed about sharing our health data, we often will say no. So probably very few of us, if any of us, have taken part in a clinical trial or have taken part in a regulated healthcare study. So it's an interesting concept, because all this data is already circulating, but sort of whose hands is it in, and what's it being used for, and when and how? These are all, important questions.
Can I push you to talk a little bit more about whose hands it's in? Because I get that some people are on Facebook, and we would know in a moment if Be Real called on them to take photos. But as we think about Facebook, Google, Meta, these are private institutions that are exploiting your personal information to make money.
Yeah.
Is that different from governments that are taking this information in order to, best case scenario, improve public health, worst case scenario, maintain power?
So I think if you take one thing from this talk, I want it to be that they're really intertwined. So governments or public institutions are constantly working with private companies. I mean, drugs don't get developed. New technologies don't generally get developed in a vacuum. So for example, one of the examples in the book is about the NHS in Britain, which is public healthcare. And they basically were developing a tool, but they were partnering with Google. And the question was whether they should have been using this data for the purposes that they were, which, spoiler alert, they shouldn't have been. So I think it's really intertwined. And I think if you ask people, I mean, if we did a show of hands, most people here would be much more happy to hand over their personal data for public purposes. But I think the fact is, when you look sort of behind the veil, a lot of the time, if you are sharing data with the public, there is a private element often intertwined. And when we talk about these companies, they're so huge. And then you can think of the ability of the state to develop technologies is so much lower. So they're always going to draw on companies. So, I mean, in the EU framework, it's not, the dichotomy isn't about public or private, but it's about the reason why the data is being processed. So are you processing the data for scientific research purposes? It doesn't actually matter if that's for profit or not. What matters is the purpose, compared to if you're processing data for marketing purposes, for example, which is a different standard where different protections apply.
And so we're talking about who's collecting the data. We're talking about what data they're collecting. I hope to turn now to talk about when the data is collected, and specifically talking about public health emergencies. You weren't sure if you're an optimist or a pessimist. The COVID-19 pandemic response and the use of health technologies, and specifically surveillance technologies, doesn't give me a tremendous amount of hope. Should we think about the rules around this balance between technologies and human rights differently in a public health emergency?
I think that people do. That's the interesting aspect from my position. I mean, like I think you're getting at the same point. I was kind of appalled in the early stages of the pandemic to hear certain governments being lauded for their responses, which were completely contrary to human rights. But it seemed, at least at that point, to be effective for short-term, at least, public health goals. And I don't think the standards should necessarily change, but I do think that populations are willing to tolerate different standards depending on what the calculus is. So perhaps now people feel safer, they feel more secure, and they want less intrusions. Whereas when we were all sort of trapped inside to a certain extent, then people sort of said, okay, whatever you want, like, let's get out of this position. So, but I think the same standards should apply to a certain extent, especially when we talk about things like surveillance technologies. I think when we talk about, for example, developing research applications or developing vaccines, for example, and we had a lot of, research ethics approvals were sort of fast-tracked in a lot of cases. I think maybe that's different compared to when we talk about surveillance. And I think what we've really seen with the pandemic is that often these sort of high-tech solutions were sort of thought of as the answer, but really what we needed was actually basic public health.
And so as we think about these questions of the pandemic response, and I'm not sure if it's so easy to tell when the emergency ends, or if we're there now, or if we're not, or it depends on what country we're in. I want to speak to this question of technologies being rolled out, not surveillance technologies, but new pharmaceutical technologies, new public health technologies. In the emergency, they were often rolled out without rigorous testing. And we're still seeing, most of us have now had vaccines that have not been tested in the same way we've tested previous vaccines. How do we ensure that the lessening of those standards doesn't pose a risk to health and human rights? Or if we're willing to accept some risk, how do we determine when too much is too much?
Yeah, I think here it's going to be really also what the population sort of accepts. And I think I think there's, a certain level of people being jaded now by the emergency. And I mean, an important concept in my work is solidarity. And I think solidarity has definitely waned, and people are more thinking about themselves as individuals again, and thinking, well, I don't want to suffer, or I don't want to bear the burden right now. So I think it's always sort of going to change depending on where populations are at. And I think what we experience is also this sort of extreme fatigue now. So many people feel that the emergency is over, and they're not willing to tolerate sort of incursions. My fear is obviously that winter is coming, so we're going to see what's going to happen.
So before turning it to the audience, and we'll turn it to you in just one second, I do want to end by talking about this question of solidarity. Even under the best of conditions, with the best of new technologies, they are not shared equitably throughout the world. We see inequality, we see discrimination in our global governance system, and the ways in which we ensure that the people who need things most are able to achieve them. Can human rights speak to these questions of equitable access to essential technologies?
So I think yes, but the question is whether we listen. So I think, there's different issues. I think one is what technology is being developed, and why. I think often the technology that's developed is in some cases it's driven by funders, but it's also driven by what people are going to pay for. So companies are beholden to their shareholders. They want to make money, so they're going to make technologies which, middle class people with too much money are going to buy often. And that's a huge risk when we think of disease burden, when we think of where healthcare technologies would actually be helping and who they would be helping. And then the other risk that I think is important to remember is sort of legal risk. So if we have a weak global governance system, which we currently do, what we've seen in the past is that companies will just move their practices to places where the standards are lower. So you may trial an algorithm, you may trial an app, but then will the population on whom it's being trialed actually have access to that, or will it actually be rolled out in a population who is going to pay for it? So I think there's both there's the legal risks and the equity risks.
Okay. Well, thank you so much. It was a really exciting book. I hope to turn to audience questions now. Please let me ask that you raise your hand, and I'm going to go turn on the microphones in the rest of the room so that we can make sure that we hear you. But we'll begin up front while we still have microphones up here.
So I was really intrigued by both of your discussions about vaccines and the difference in what's come out. So remember in the beginning of the pandemic, it was an all or nothing, and the country was very polarized in terms of vaccines. And now it seems like there's a more nuanced discussion about the safety of them. So how do you think ethics and technology can also be, you can also hold maybe media reporting of certain medical things during emergencies in a way that causes bad social impacts? Is there a way to hold that accountable? For so long we thought it was one or the other. You can't question, or you have to take it, or there's a labeling things one or the other. But how do we make sure that people, know the public health information that they need to know?
Thank you so much. So I think one problem in a way is the word certainty. And I think there needs to be a lot of public outreach and education about scientific uncertainty, because I think sometimes in the past things have been presented as with certainty, and maybe from this optimistic perspective of solutions and trying to kind of encourage people, which, I don't know about you, but I really needed at a certain point. And then later on, people can feel that they were lied to, or that things were misrepresented. So I think that, communicating that scientific knowledge develops over time. So for certain vaccines or treatments, you'll have some studies at one point, and then much later you're going to get more data coming in that's going to maybe tell you a different story. And I think there can be this rush to sort of jump on the idea of certainty that's just unfortunately not present for anything, be it vaccines, but also treatment. I mean, if a lot of my work has been in personalized medicine, which is really talking about how how often treatments don't work for so many diseases. You think you're sick, you get some pills, you get better. And sometimes for the majority of patients, that's not actually correct.
Science takes time.
And so if I can take that question from the optimistic to the pessimistic side, as is my nature. How do we think about the role of human rights in preventing misinformation? Specifically misinformation by either malevolent private actors or by government actors themselves.
Yeah, it's really difficult because, of course, human rights includes freedom of expression. And I think that sort of completely shutting down expression is incredibly problematic, of course. But then we think of freedom of expression, we have this current framework of Twitter where, you know, people can present things very convincingly and, you know, get a big following. But of course, it can be complete lies. So I think there needs to be more balance. I think there needs to be more education. But I don't necessarily support a very heavy-handed approach. And I think more has to be done to sort of tackle the companies. And for example, what tweets the company is pushing on people, what ads the company is pushing, because there has been, you know, of course, it's sort of, I mean, I don't know about you, but often the things I see are this sort of, you know, most inflammatory rhetoric, and nobody ever likes my, you know, pet tweets. So I think that I'm looking at you. No, but I think that there, you know, the processes of what's going on behind the scenes, and we really need to focus on what companies are doing and to sort of bring down the polarization and to bring down the focus on, you know, individuals being good or bad, because I think, you know, and I'm not from the US, like as an outsider, I think there is so much polarization and it's not healthy for anyone.
Oh, no, you see it right. Other questions?
Hi, at the end of your speech, you have a call to action. You say that you would prefer a global regulation to stand the test of time. And I guess I just wanted to inquire a bit more like that would look like for you. And then I wanted to pose a second question of, do you think that's an appropriate approach considering such quick advancements of technology? Should it be more of a like set in stone regulation, or should it be something as malleable and as technological advancement?
Thank you so much. So I think it's really problematic currently that we have such different standards, and we have this in a lot of different areas. But I think as long as companies can do what they like in certain regions with data, of course, they're going to exploit this. Why wouldn't they, in theory, to make money? But how does that look? I mean, how do we get standards that can adapt with time? I mean, I think it's feasible. I think one problem is sort of to understand the technologies and to have adequate engagement from different stakeholders. I mean, in the EU right now, they're proposing a lot of different regulations, and there is a pretty robust system of actually engaging with different stakeholders. I think the problem, of course, can be when certain interests will drive processes and undermine protections. And something that I didn't really address, but that is important, is just because you have a standard, you also need it to be enforced. I think quite often we get a standard in place, but it's not enforced. So for example, in Europe right now, we have a problem of data protection authorities not being adequately resourced. So yes, we have these strong rules that you've probably heard of, and you think, okay, this sounds really serious, but the data protection authorities, they don't have the funding to actually investigate, and necessarily to impose sanctions often, because they just don't have the reach. So, and also things like the ability for individuals to make complaints. This should be easy. I mean, if anyone ever tries to report things on Twitter or Facebook or these different platforms, I mean, it's really difficult actually to sort of successfully do so. So I think there's different aspects.
And picking up on that, if we think that these human rights standards are universal, exist throughout the world, would there be a role for United Nations specialized agencies in developing some of the rules of the road to make these human rights a reality and to operationalize them through global policies?
Yeah, definitely. I think the risk, of course, is that the standards will be too weak. But I think at this point, we need to start somewhere. I mean, I think there can always be some sort of minimum. I mean, one of the recommendations has been by the Special Rapporteur on privacy, and he's recommended a sort of like global principles. I think in terms of in Europe, we have a Council of Europe treaty, which is actually open to any state. So other states could ratify it. And that's actually really similar to GDPR. So I think there is definitely, and Council of Europe is a human rights organization. So I think there is definitely prospects there. But again, you know, you can have lovely treaties, but if they're not being enforced, and of course, as we well know, the issue of financing in global health is very problematic. Yeah. Oh, data protection regulation, GDPR, yeah, sorry.
Other questions?
Yeah, so I guess in terms of thinking of an example of accountability from companies, that kind of made me think of when the pandemic first came about in the US and contact tracing with the amount of tracers that states were able to hire wasn't working. So Apple and Google come in and they step up and they spend all this time using their R&D money and all these man hours to kind of create this like encrypted token contact tracing thing that works with everybody's phones. Months later, it comes out and then nobody adopts it. Like nobody downloads the app.
Yeah.
So what kind of incentives do you think would work on the individual side when we can't mandate rights?
Yeah, really good example. And I was seen in a lot of countries. Unfortunately, in some countries, it was that the government that put a lot of money into the contact tracing apps, and then uptake was pretty low in a lot of countries. I mean, I think, of course, you can encourage people, but the issue again is that if it's untested, I mean, if you don't know the effectiveness of the technology, then I think you, again, like going back to your question, you also have to be sort of wary of being honest and saying, well, we're experimenting. This could help, but, you know, no guarantees, because I think otherwise you can have this pushback of people being angry and I shared my information. I think with any of these apps as well, there's sort of the question of you know, privacy and of what data is being shared and with whom are really key to any solutions. But I think at the end of the day, yes, sometimes populations won't adapt the technologies, and maybe that's okay. I mean, maybe there's a reason behind that. And I think sort of pushing or forcing things on people is not, I think we've seen it's not always the best approach, especially for long-term sustainable solutions.
Other questions? In the back?
So I have a question that goes maybe in a different direction. One of the externalities that we have with all of this big data, right, is the server space, right? We're generating all of this data. All of it needs to be stored. And at a certain point, I think parallel to conversations that we're having around blockchain, around NFTs, right, around kind of some of the fintech pieces, there's kind of a sustainability cost. There's an environmental cost, right? The server space needs to be paid for in terms of energy, and we're facing a climate crisis. And so I'm wondering if you can reflect on, how do we kind of thinking about climate change, thinking about sustainability, like what does that lens do for how we think about engaging with health tech?
So it's a great point. I don't have a great answer, but it is something that that is important to sort of increasingly talk about. I think this idea of like, let's gather lots and lots of data, and that there's no problem. Like, why not just gather more and more data? And I think slowly people are coming around to, okay, actually, it's not free, and there is, and I mean, a point I haven't raised that is adjacent to that is that there is actually so much data that has been collected. It's just not really, it's not being used, and it's not always so easy. I think to a certain extent, there's an idea of, okay, if we have a lot of data, we can develop really cool apps or really cool tech. But if you have very unstructured data, so, for example, in the US, you have a lot of electronic healthcare records that can't speak to each other. You have different systems. The data may have different flaws. it may be lacking in different ways. So not all data is worthwhile or helpful. So I think that questions around sustainability are going to be increasingly important. And of course, they are sort of being addressed in certain countries are trying to address it. I mean, in Denmark, they sort of developed a new sort of supercomputer, I think is the word it's called, which is, supposed to be more sustainable in covering different bases of what sustainability means. But I think it also goes back to that question of if we're developing lots of different technologies and the technologies are unsustainable in the idea that we develop an application. So let's talk about the contact tracing. I mean, what's happening with the data now? What's happening with these apps? Can they be repurposed? Probably not. We're just going to develop a different app for something else. So I think kind of constantly jumping on different fads is problematic from many different perspectives.
It speaks to a larger question of the responsibility of the health sector for mitigation in the climate change response. Yeah. Other questions?
So going back to incentives, but on like a much larger scale, on an international scale, and tying in the technology disparities, since priorities in healthcare are so different based on culture, based on location, and in different countries, what are ways we can almost incentivize countries who might not be so interested in creating and participating in a global healthcare like governing system?
Yeah, so we're probably in one right now. I mean, the US is not very good at signing up to international treaties or international standards, for example. And I think it's a general problem in global governance because you have countries that are very wealthy that will sort of exert a lot of pressure on the process of negotiating standards actually, but then in the end, they won't sign up to the standards themselves and they don't actually have to. So I think that's a whole political question, I suppose. Whereas I think sort of you also need to develop, I mean, if we're talking about in terms of adoption in different countries, I mean, you also need to develop systems that countries want and that countries think they can use and they think are worthwhile. So actually sort of engaging with communities, engaging with people and trying to actually, make tech that works for people instead of just what companies sort of think is cool. And I mean, developers will sort of get really excited about things and maybe not necessarily think of the populations at stake. And that's where social scientists have a really important role to play here.
You've mentioned earlier, like a lot of misinformation. So how, as a consumer, are we supposed to balance reading that news and also with the advances in medical technology to make sure that we're consuming the right information in an appropriate way so we can ourselves make the right decisions?
I think it's really hard. I mean, there's been like lots of different studies about if you were going to read all the privacy policies of all your devices, of all your apps, it would take longer than your lifetime. So I think in a lot of ways, if you read Zuboff's book, I mean, in a lot of ways, it's sort of a bit hopeless, I think, which I hope it's not. But I mean, I think as a consumer, as an individual, as a person who at some point will come in contact with the healthcare system, unfortunately, or fortunately, depending on the circumstances, I think that, yeah, the sort of asking questions, I think, is always really important with anything to do with healthcare. That doesn't necessarily mean in a very adversarial position, but I think sort of trying to get to trying to get the information and trying to make sure you're understanding and also being aware of choices. I mean, in autonomy in healthcare is very important. I think when anyone is sort of confronted with the healthcare system, at least I sort of have a general feeling of like, oh, well, the doctor knows, like, let's follow the doctor, but that's not how a doctor actually generally wants a conversation to go either. So I think this sort of more collaborative approach is necessary across the board in healthcare. I think, going forward, there's all these sort of prospects of in the future that when you go to a doctor, you know, it will be an algorithm making a decision, and this is really discussed in the literature. I think already there's a lot of algorithmic decision making in terms of, you know, basic triage is done using a very basic algorithm. So I think the sort of awareness of how healthcare already works is important, and sort of asking questions and taking part, but also I think maybe I can say also advocating for better standards, because I think also as consumers, as individuals, we're often really badly placed actually. And I think this sort of focus on individualizing responsibility is really easy, or is really helpful for technology companies, when it's actually kind of impossible for the individual in many circumstances to make this decision in an informed way.
Can I push you a little bit more on that? Because if we think that we need new standards, but if we think that individuals can't possibly read all of the privacy information that they're given, then how much autonomy do people really have if they're not actually, if they don't know enough to make an informed decision? So should governments take a greater role, maybe even a paternalistic role, in protecting individual privacy, knowing that individuals will never be able to truly protect it on themselves, by themselves?
I mean, I think you can make information more understandable. So there is sort of growing pushes to, I mean, you know, these like huge privacy policies. I mean, you could actually, you know, in a few sentences explain what you want to use the data for in many cases, but companies don't want to, and they're not forced to. So, okay, sure, you'll get a lawyer to draw up this whole huge privacy policy, but it's not really designed in a manner to be understandable. So I do think that that can really be moved actually. So I think it's not hopeless in that sense. But yes, I do think that there also needs to be limits on corporate behavior. I'm not generally super paternalistic, shockingly. Maybe for US context I am, but in the European context, I'm not very paternalistic. So I do actually think I do actually believe that, you know, people should be able, and I think it's a fundamental principle of healthcare law, is that people should be able to make decisions, also what I might think is a crappy decision. So you can refuse a treatment if you don't want the treatment. And I think that should be maintained. And just like you can agree to a really bad privacy policy, if you just really want to read that article on whatever awful website you're giving your data to.
Can I just follow up on that? Because I feel like, you know, and this is present in mind right now because of, you know, having to create accounts on academic portals to submit manuscripts, submit recommendations letter, all that kind of stuff, right? And if you don't agree to the privacy policy, you cannot move forward, right? And I think all of us are in a position where we have sites where, you know, we need to engage with that, right? That is the gateway to be able to do whatever it is that you need to do. And if you say, I don't agree to this privacy policy, or I know I don't want to accept your cookies, you can't move forward, right? And so how can we, you know, put in place kind of a regulatory framework that deals with that to say, what is the functionality that that's a minimum required functionality, right? If you want to opt out of the crappy privacy policy.
Yeah. So for example, when I'm in Europe, there's a lot of US websites I actually can't access unless I agree to the cookie. So I will go into it and I click, and that says, sorry, you can't access this. And sometimes it's like health information that I actually want to access. So I mean, in the EU framework, for example, that's actually not allowed. So you can't have a consent where you don't have an option to say, no, that's not a valid consent, right? So I think there is actually a sort of an answer there. It doesn't mean that data isn't being processed for sort of questionable purposes, because as I was trying to explain, there are different purposes under which you can process the data anyway. It's not just consent, but I think to use consent as a basis when you don't have an ability to opt out, it's just perverse. And I think that's something that can actually pretty easily be changed.
So there are some risks to all of this, and we need to explain these risks in a way that makes sense to the public. And some of these risks can be explained more simply and shorter than they already are. But some things take a little bit of time to really unpack and develop. And one of those amazing things is Health and Human Rights by Katharina Ó Cathaoir. And so I hope you will take a look at this amazing new book. Please join me in thanking our amazing. This is the 9th lecture in our annual series. I look forward to seeing many of you back next year for our 10-year anniversary celebration. But for now, thank you so much for joining us and coming over from Europe. And I'm excited to read this book and continue to use it as we build this field. So thank you all for coming and look forward to working with you to create a world of health that is founded upon human rights. Good luck, stay safe, and we'll see you soon.
Ghosted you on this paper. Pandemic happened. But it's on my brain.
Yeah, I mean, let me know. I always have. Yes.
I was like, oh my gosh.
Yes.